Hey there, welcome back to Breakfast with Bridgett. We've been talking about back to school all week, and back to school also includes those after school activities like sports. And it's important to be prepared and know what you're getting into and making sure that you're physically fit. And so the two go hand in hand. And today we have Dr. Gerson Valencia from Orlando Health Children's Hospital, Arnold Palmer Children's Hospital. And it's great to have you with us this morning.
Hi, good morning.
And you are a pediatric cardiologist. And so it's all about really taking care of that system when it comes to getting kids ready for sports as well. So this goes beyond just getting just your regular physical, but that's the baseline,
Mhm.
right?
Right, so kids nowadays. Now it's starting school year. They go to their pediatricians, their primary care providers to get their pre-participations sports form, and within that, there's a specific cardiac screening. Right, the whole point of this is just to overall, catch on time or overall decrease the prevalence of sudden cardiac death, which is actually the most common cause for death in young athletes. So it comes with a set of specific questions that are laid out on the form, and then some counties in Florida and some other states will also require an EKG, which is an electrocardiogram. The electrocardiogram is a great tool, but it does not detect 100% a lot of the things that could predispose you to for these sudden cardiac events. So it's very important for pediatricians to have conversations about what are the things that to look for as you start sports, because we do encourage kids to participate in sports. What are the things that they should look for when they're playing, and go through family history and all the important things that can put them at risk, when they're out there in the field.
And we talked about some of those conditions that can be exposed through those different exams. So, what happens if your child does have one of these conditions that may make, it questionable to
Mhm.
get involved in the sport?
So yeah, some of the most common things that could be picked up with an EKG would be hypertrophic cardiomyopathy, um, and there are other things that could be something that the kid was born with that has not caused any problems throughout their lives, that we do believe they're low risk. So even when you detect a condition that could be at a high risk for sudden cardiac event, it's more of a shared decision. Nowadays we rarely restrict kids from sport participation. Some kids might need to take a medication to decrease that risk. We do a lot of other tests or additional tests like echocardiograms, stress tests, to risk stratify those kids, and but it comes down to more of like a shared decision with the family, the coaches, the student, and see what they really want to do, because we don't want them to be just like sitting down and not doing any physical activity throughout
Mm-hmm.
the year.
And of course, when it comes to physical activities, emergencies do pop up. And so we see,
Mhm.
kids get hurt, whether it's something, you can see, like a broken bone or maybe a strained muscle, but you also, will have kids that may pass out and have different types of episodes, maybe related even not to the heart, but to the heat. Can you talk about some of those risks involved with being in these sports, especially in Florida?
Yeah, so I think we've all seen videos or of kids just passing out on the field. Sometimes it could be just very benign from being not well hydrated, especially in the Florida heat. But sometimes those events can be more, from having a condition that predisposes them to having a sudden cardiac arrest. So we have in place requirements for high school students. They need to learn how to provide CPR. They need to learn how to use an AED, or things that they can do to recognize promptly someone that's going through these events. It's not just someone that actually passed out, but it's someone that could die, and how to approach that situation. So I think coaches, students, I think that they at least require one hour of a year for to refresh all of these knowledge. But I think that's one of the most important um, things that uh, that we do nowadays with high schoolers, that they can just recognize promptly these problems.
Well, great information to have, and of course, we hope everyone will, have a safe school year and sports season, and hopefully not have to come see you for any emergencies.
Yeah, that's for sure. Yeah. And all of this is done more by, their primary care providers. If, the very few of the kids that get all these sports form filled out, or cardiac screening, they something that would flag out as abnormal, that's when they would, refer them to us. So not everybody needs to be seen by a pediatric cardiologist.
Mm.
But it's, but we're here to help if there's anything,
All right,
they're
wonderful.
concerned about.
And it's great to know it doesn't necessarily close the door to them being able to participate too, even if there is something that you need to treat them for. So that's great news. So we appreciate the information, Dr. Valencia. Thanks for being with us, and have a great weekend.
Yeah, you as well. Thanks for
Take
having me.
care. Thank you.